Hi everyone, my name is Jessica Bastear, and I'm going to be discussing the clinical symptoms, modes of transmission, and the mechanisms of prevention for MRSA, or methicillin-resistant Staphylococcus aureus. The overall condition of MRSA is best identified by the lack of symptom relief after antibiotic treatment, specifically methicillin-based antibiotic treatment such as penicillin. In terms of clinical symptoms, the most common symptoms include bumps, boils, or abscesses on the skin that are appearing red or swollen and are warm or painful to the touch. Often these boils will also be draining pus. Another common symptom that appears in more severe cases of MRSA would be a fever that accompanies these bumps, boils, or abscesses. And on the right is an image of an abscess on someone's back prior to any form of treatment. MRSA is transmitted by person-to-person contact, either direct or indirect. Direct contact with an infected body region or direct contact with fluid that is draining from someone's abscess on their body can transmit MRSA to that individual. Indirect would be touching an object recently touched or used by an infected individual in a previous setting. Common items that aid in spreading MRSA in the indirect route would be sports equipment, shared sanitary items such as bath towels or razors for shaving, and used bandages. And used bandages, usually you would come in contact with them based on your profession, whether that be swapping out bandages on a wounded person or just disposing of them in general. Primary prevention of MRSA includes washing your hands regularly with soap and water, cleaning and covering wounds by yourself and as soon as possible after attributing that wound. Also important is handling one's own bandages, whether that be changing a bandage or throwing out those bandages. Using one's own hygienic items, and hygienic items again includes bath towels and razor blades. Regularly cleaning bed sheets and clothes is also very important in order to kill and wash away any MRSA or regular Staphylococcus aureus that may be growing. And in terms of healthcare providers' primary prevention, they can purchase antibiotic-coated products such as rubber gloves or tools such as scalpels and things like that. Secondary prevention is simply test any skin infections you notice or are diagnosed with as soon as possible. This can help catch and treat MRSA before it causes any severe damage or grows in its severity. The tertiary prevention involves having a healthcare provider drain the abscess with an incision or removing the exterior tissue containing the pus or fluid. Also, vancomycin injections can be used as tertiary prevention to help eliminate any further growth of Staphylococcus aureus in the body or in the wound. Vancomycin is a non-methicillin-based antibiotic, which is why it's a little more useful than something such as penicillin. And on the right is an image of a MRSA abscess that has been drained and had damaged skin removed from around the wound to help aid in the recovery process and eliminate any, or hopefully eliminate any future growth of MRSA in the area.